To move from clinical or theory to clinical assessment, we now focus on measurable lung volumes and airflow. These measurements allow us to quantify ventilatory mechanics at the bedside. And we're going to be looking at, and you should be able to reproduce this image and be able to define all the different volumes and capacities seen on this slide. When we are trying to figure out how well the lung is moving air, we use spirometry or a spirometer. This measures dynamic lung volumes and capacities. These values reflect ventilation mechanics, not gas exchange, which is important to know. It's representing how well are we moving air, not how well we're actually moving oxygen and carbon dioxide. But it is essential for diagnosing obstructive as well as restrictive diseases, things like asthma, COPD, or even things like cystic fibrosis. This diagram visually summarizes our different respiratory volumes and capacities. We can see tidal volume here at this baseline, 500 milliliters. We can see our reserve volumes on either end, inspiratory reserve and expiratory reserve, as well as our residual volume and how we can then add certain components together to get specific capacities. Understanding how these volumes combine into capacities is critical for interpreting our pulmonary function test. Tidal volume is the quiet breathing volume. It's the amount of air that's moved into and out of the lungs with each normal restful breath, versus inspiratory reserve volume reflects the maximal inspiratory effort beyond tidal breathing, and it depends on muscle strength and compliance of the lung tissue. Residual volume prevents lung collapse. It keeps some lung or some gas or air essentially in the lungs at all times, and it maintains gas exchange between each breath. Expiratory reserve volume is the amount of air that could be forcefully expelled beyond a typical restful exhalation. Now, our lung capacities, these are just combinations of the volumes we just defined. They reflect functional aspects of ventilation, such as inspiratory capacity, functional residual capacity, and vital capacity. So, for instance, inspiratory capacity here is essentially how much air can we breathe in. It's the amount of air that we breathe in a normal breath, plus the maximal amount we could breathe in on top of that. So that's our inspiratory capacity. And this has like standard normals, again, for like an average AMAB individual. Then we have our functional residual capacity. Well, it's everything that's not included on kind of our top portion of our curve. So it's going to involve, oh, I'm going to try to erase. There we go. Oh, maybe not. How annoying. Oh, okay. So this was our inspiratory capacity. This is our expiratory, our functional residual capacity. This is involving essentially our expiratory reserve volume. So how much can we exhale after a normal exhalation, plus whatever air is left over, right? Our vital capacity is like the typical air that's moving in and out. So if I took a maximal inhale and then I exhaled all of my air, what's the maximal amount of air that I can actually have move in and out between each breath, versus total lung capacity is the amount of air that can be in my lungs at any given time. So if I take a maximal inhalation, how much air is actually in my lungs at that time, including the residual volume? Let me see if I can get out of this. There we go. So this is kind of a review. Oh, this is going to be very annoying. Hold on. So this is going to be a review. This is essentially showing all the different volumes and all the different capacities, and you should be able to define them. I don't need you to know normal values, but I do need you to define them and be able to calculate those values yourself. We're going to stop here. When we come back, we'll look at what is dead space.